everyone. I am Aruna Kumari, Associate Professor in the Department of Information Technology at Mallarity College of Engineering and Technology. And I'm delighted to be your host for this afternoon. It's my privilege to extend a warm welcome to all of you to the 11th session of the AICT-sponsored 6-day Atal Faculty Development Program on Next-Gen Solutions for Medical Challenges powered by AI-based intelligent systems organized by the Department of Information Technology at Mallarity College of Engineering and Technology. Before we begin today's session, please be aware that attendance is mandatory for each session, and your attendance will be confirmed only if you fill out the feedback form. And also please note that the feedback form will be shared exclusively only in Zoom chat box, but not in your WhatsApp video. Participants are required to maintain a minimum attendance of 80% and should secure a minimum of 60% assessment marks to be eligible to get the certificate. So without any further delay, let us start today's session. I'm delighted to introduce our esteemed speaker for today's session, Mr. Harish Bommidi. Mr. Harish Bommidi is a highly skilled SAP ABAP developer with over 10 years of IT experience, including significant international exposure. Mr. Harish Bommidi is currently working at Tata Consultancy Services, specializing in ABAP, and he is a certified SAP Development Associate with expertise in ABAP, OData, AMTP, CDS, Views, and ABAP on HANA. He is well-versed in both implementation and support projects, with a strong background in migrating legacy applications to Fiori apps, enhancing business applications, and providing end-to-end solutions. He has a solid foundation in multiple programming languages and tools such as Java, HTML5, CSS, JavaScript, and have successfully worked on academic and non-SAP projects, including IoT-based systems and online platforms. Dear all, please join me in welcoming Mr. Harish Bommidi. Sir, we welcome you.
Thank you, Aruna. Thank you, everyone. So, can we start? Can you hear me, first of all?
Yes, sir. Yes, sir.
Yeah. So, one sec. Yeah. So, good afternoon, everyone. This is Harish. First of all, I would say thanks to Dr. K. Suresh sir is the Professor Dr. K. Suresh sir. So having me this opportunity to give this FTP program and the So the coordinator, the PV Naresh sir. So I'm very thanks to everyone and who are then the participants. So very good afternoon and having had the good break lunch, and so we'll have the session will actively participate in this one. So and now so without delay in this, so we'll go into this topic. The article discussion is in a real world applications and research directions in healthcare technology. So before going to this topics, I want to give some little bit intro on this topic. 1 second, let me share my screen so that you can able to see all my presentation. Okay, 1 sec. So hope everyone can see my screen, and we'll go.
Yes, sir.
Yeah. Okay. So this is the topic we are going to discuss in another 90 minutes, further 90 minutes. And and this is not a complete technical discussion. So we'll try to correlate all the topics with the real-time scenarios so that everyone can understand very easily. Okay. So the content of this today's agenda is, So I'm going to explain the topic is research directions. Before going to research directions, we want to know where the applications, the real-time applications we are using this AI in healthcare. So that's why we bring it into real-world applications. And so to know that, so we want to know what type of technologies also including in this healthcare. That's why this topic is came into this picture. And so the types of AI and the introduction. So what we are doing is first we'll go with the introduction, then we'll check with the types of AIs, artificial intelligence in that. So, and one AI is not in a single technology, it is using the multiple technologies. So we'll going to cover that multiple technologies as well. And then we'll go into the real world applications. Okay. Then we'll go step into research directions. Okay, let me start the presentation. Yeah, so this is all the content. Next, the introduction of healthcare technologies. Okay, sorry. So I'm not going to explaining completely in this slide. So we'll discuss further in the slides. So this is just like an overview. Okay, in healthcare technologies, what type of things we are using. So first of all, the enhancing decision making. So what is the decision making is like in nowadays, I can say like in uh, mm, every application or every sectors, AI is moved taking their responsibilities. But in a healthcare also it's came, but it is not the competitor to humans. For example, so as I'm an IT developer, I'm working in some developmenting tools. So but the AI came into this IT sector and it is grabbing all the human jobs. But it is happening in all the sectors, but in a healthcare it is not like that. It is just like AI is giving the support to human but not a competitor to the humans. That is what I can say that. And here it is giving some decisions making to users like the doctors who all are there in the healthcare systems. And they have the different type of categories and different types of what you can say applications we have that. So that is what I'm going to explain now. So and when we are trying to use this AI algorithms, it is giving the 91% of percentage of accuracy compared to the human experts. Okay, and the streamlining administrative tasks. So this one we can say like in AI it is not only giving the suggestions, it is also it is doing all the administrative works. It's like for example, if we are going, anyone is going to hospitalized, so they have the multiple departments is included, and we have to streamlines like so everything need to be in a one track. But currently it is not in a different sectors will be there like I can say first taking the appointment, later we need to take the diagnostics and then get the documentations and then climbing everything. There is a different type of tasks is there. So this AI will use to combine all, and it will give us a very easy administrative task easily for this I can say AI. Okay, and then there is a personalized patient care. So it's just like it is take care of everything regarding the patients. Nowadays the old people are, many old people are there, they don't have the support from the human level and the or nursing type, or how to mm, take that medicines on time to manner. And the I can say there is a another apps also giving all the time to time notifications, and there is uh, a personalized I can say digest plans, sorry, not digest, so I can say meal plans, something like that. So the everything can be taken care by the AI. This is what all the topics we are going to cover in next 90 minutes. Okay, so now the next topic is types of AI. Actually, the AI is not in a single topic, it's like a multiple technologies. So the based on their functionality and capabilities, they have divided into multiple AIs. So why we are categorizing? Because so if you keep all in a one place, that is not handled perfectly. So I can say, so even if there is any big task or complex task, so if you are splitting into multiple subtasks, so it is very easy to accomplish the task very quickly. So that's why they have divided into multiple parts. So I can say, so there is here the author, like what the article discussion in this article. So the author has divided this types of AIs into two parts based on their capabilities and their functionalities. So the capabilities is like weak AI or narrow AI, and there is a general AI, super AI. So these are all like capabilities, like how much of techniques or how much of data they can handle it. Based on that, they have divided into these three parts: weak AI and narrow AI and general AI, super AI. And coming to the functionalities, so how to react, how their the AI is reacting to human interactions or their inputs. Based on that category, so there it is divided into the four parts. There is a reactive machines, limited memory, theory of mind, and the self-awareness. So it is not only this restricted, but it is some of the types of AIs. Okay, so we will discuss each and every topic in detail, and we'll get to know the understanding very clearly. Why I'm giving this topic to a real-time application? Because if you know this all the basics, then only we can understand the depth knowledge of like application, real application research topics. Okay, then coming to types of AI. So there is a, we said like there is a weak AI or not narrow AI. It's just like a self-explanatory, like weak AI. So it is like the scope of this type of artificial intelligence is very less. So what I can say, so whatever we are training to this artificial intelligence, it will act according to that one only. So there is a some of examples are Siri and self-driving cars and virtual assistants. So these are the some of examples. We, yeah, means it's like they have, we are training into specific tasks, so it will not act up outbound of this tasks, so they can't go beyond that test. So that's why they have made make it as a weak AI or a narrow AI. Okay, coming to general AI, is a strong AI, is like it is act more than the human, or it's like compared to human intelligence. Like so it can think in a separate like own way, and they can take the decisions as well. Okay, so this is the general AI. And the super AI, it is like a frictional, it's not at implemented, but this is going maybe in future decades, so it will come into this real world. Okay, so these all are the types of AIs basing on the capabilities. Okay, and coming to the functionality AI based systems, we have the four, like a four type of AIs. The reactive machine AI, this type of category. So it will like reactive machine AI means, so it will react to in the form of actions. So the user will do something, so the AI will be acting according to that inputs. There is examples are the Google AlphaGo and IBM Deep Blue systems. These systems will act to user inputs in the form of actions. Okay, limited memory AI. So this is like in the functionality, it will have the very less memory capability. I can say like so it will load on the previous data, historical data, and analyze the things and do the actions. Okay, it is not a highly storable capacity. Like for example, it can't identify the future things like a future it will read the historical data and act upon that, but it can't take the decisions only slowly. Okay, the theory of mind AI, it is like own decisions. It can take the own decisions, and it will be uh, and so it will think in a human level, and the emotions, everything it can understand. That self-aware AI is like still it is in a research level, but not at implemented. But once it is come into this real world, it will be maybe it will give the very good results. So, and it will go beyond the human thoughts, I can say that. Okay, so these all are the types of AIs, and we'll go for the next technologies. Okay, so as of now we have discussed about only the AI types. So now we are going to discuss about the technologies, what type of technologies we have used in the AI. Okay, this is not only the technologies, but we have many is there, but I have listed only few topics uh, to understand the concept only. Okay, and so these are the three I have just maintained: machine learning and deep learning and natural language processing. So these are the technologies they are used in the artificial intelligence. Okay, so coming to machine learning, so the machine learning is a first, now it's in a dominant approach in that. So it will predict, it will, what we can say in machine learning, they will train the data with the historical all the collective data, and they will prepare that models, and it will diagnosis and provide some the treatments in this uh, based on the available data. Okay, the deep learning is like so it will I can say it's a very complex data. So it will read the multi-dimensional data, not only specific to few data. It's a multi-dimensional data, all type of characteristics, I can say characteristics. It will read all the type of characteristics, and it will not show that the complexity of the data, like it will hide the complexity and show whatever the data is required for human. So this is what it will do it in the deep learning. And there is a natural language processing. So this is like we have, like for example, so the many people were there having the many different languages and different type of uh, um, way of pronouncing and way of inputs they will give it. So this natural language processing will understand all type of languages and gives the proper information. That is what in a real world. But in coming to healthcare, so the type of prescriptions, like to understand that prescriptions, and for example I can say even in real time. So if you go to one type of blood like I can say test reports, so all the test reports will not have the same type of uh, I can say format, for example. Okay, so if I go to one type of one hospital, they will give it in a different format, and another shop they will give the different format of reports, right? So these all are this the natural language processing will understand all type of uh, formats and give the uh, best results for with the analysis. That's what I can say that. So mostly this NLP are using in the virtual assistants, and the who all are interacting, like the AI which is interacting with the humans directly. So that type of AIs, they are using the natural language processing. Okay, so we'll discuss in that real-time examples wherever we are using this type of technologies, they are using that. Okay, so coming to real-world applications, so we have around so everyone knows that. So there is a artificial intelligence is included in the healthcare, but it is in a different sectors. So now what we are doing is we are dividing all the applications based on their categories. So we have divided around 10 to 12 is there. So we will discuss each and everything. Okay, so this is also the precision medicine is one of the part. So there, how the AI is included in this type of discussion, precision medicine, we'll discuss on that. Okay, so mostly here the precision medicine is saying that, so I can say like, so it will take the exact medicine based on the user, like the patient symptoms. This is what it is doing, like a precision medicine. For example, so the doctor is there, the doctor, if you go, the patient will go to the doctor, and if they say, they will say symptoms. So this is what it is happening, 1 2 and 3, they will give the list of symptoms. Okay, so this artificial intelligence, this application will do all the analysis, and it will take the necessary inputs. The necessary inputs in the sense like, so for example, if I go with a cold, so okay, for that cold, it will be happen for multiple, like diseases, not only single one. So some people might have, will get it for outside weather. Some people might have get the cold with dust allergy. Okay, so the doctor will check with the what you have done, and they will check all the history. So what is happening, and what is your like the previous things what you they have done, everything they will check it. Same way artificial intelligence has to take this all the considerations and give the prescribed medicine. So that's what it is happening in this precision medicine. Okay, so what it will happen, it will consider all the age, gender and race, everything. So and also metabolism also. So for example, few cases, even few months back, I saw one interview. The doctor, like anesthesia, gave an interview. So he said like, so when he went to operation theater, he's asking us the patient that what is your caste. So why they, so I just like shocked why they're asking the caste, because so even the in caste, why is asking base, so in some few caste people, they will not eat the non-vegetarian. So for vegetarian peoples, they want to give the very less number of doses, that anesthesia. So because so these all the characteristics will consider, has to consider that. So that's why I'm giving this example, because of this all the characteristics needs to be covered. Okay, so and so these are it will okay, and yeah, so it will consider all large multi-dimensional biological data sets. So multi-dimensional in the sense, so it is not only restrict with the one type, one path, it will go for the genes and the previous generations data, and the current scenarios like the outside weather conditions, and how the food habits, lifestyle, everything. It will cover everything and will give the proper medicines. This is what this application will do that. And there is a one example that there is a, this is an application actually. So the Intel and there is a research institute has developed one learning algorithm, and it is detecting up to 23 patients with a accuracy of 85% of accuracy compared to human. Okay, so now we'll go into the next one. So improve disease treatment. So previous one we discussed only for uh, the medicine prescription. Okay, so now it is going for the disease treatment. Okay, so for disease treatments, it's not a high level. So for regular diseases like the diabetes and uh, this is lung diseases. So for this normal regular diseases, so how the AI is treating the patients. So this is what one type of application. Okay, so there is a one application, and the control. So this is the one type of application. It is controlling the diabetes. Okay, so how it will handle it is, so this is not giving the, like you can say, so for example in real time, so when we went to that diabetes hospital, so there will be few nurses will be there. They will check all our lifestyle and the food habits, everything. Okay, this is like it will be same for everyone, right? So the AI will think, read the all the inputs and take that recommendations, what type of food we need to eat. But this type of recommendations will not help us for other diseases, right? So this type of application will do this. Okay, and so what it will do, so it will read how much of food we eat, and daily how many times we have to eat, and what type of food we need to take it up, and how many calories we need to take. So everything it will be predefined in the model, and so based on the user inputs it will collect all the data and do the analysis and perform the giving the outputs to the patients. So here you can see there is a meal suggestion based on a user got adequate blood sugar levels also. And I can say there is some wearable devices we have it. So that devices will uh, detect our blood sugar levels, and it will give the based on the sugar levels it will provide the meal suggestions. So this is one type of application, and there is another application, respep health application. This is a chronic disease management app. So it will, like I can say this one, it will read our breathing procedures, and based on that breathing things it will identify how much of the so what type of diseases he can do, and it will analyze everything and will give the results. This is one type of another type of application. So it will be used in the disease treatment levels. Okay, and there is a another type of AIs, so which will support when we are having the human errors. Okay, so it is trying to reduce the error reduction. That is what this slide will indicates that. So and so it will avoid the human errors, I can say, in real time. So even my close relative had this type of issue. What happening is, so one of my uncle, so he is a teacher. So what happening is, few years back, so he had a surgery, and due to some issue, so he had some surgery, and that so they went for the operation, and the doctor mistakenly left few tissues inside the body, and they didn't realize till 7 to 5 years. After that, he has severe pain in the stomach. So he went to some other hospital. They treated them like there is some different disease. But after 2 to 3 years, he inside the tissues, everything tissues converted into cancer cells. So here, what happening? There is a two issues is happened. So one is the doctor is not what you can say not done the perfect operation, because he left some few tissues inside the body. That is the one type of human error, and he went to another hospital. That hospital people not scanned properly, and they didn't finalize like analyze the issue, and not provide the correct solution, like I can say correct treatment, not done the correct treatment. Because of that, he met with he is a now it is in a cancer cells has increased in body, and he is in struggling for live actually. Okay, that is what real time it has happened. But this type of all the things, so AI can do better than the human, I can say that. So this is what it is saying, 91% it is giving the accurate results. So, and where we can do, so the doing the better image processing, they can the AI can analyze this symptoms like, and the scanner CT scan. So we are doing some CT scan, right? So, and this all the CT scans, the doctors can't identify exact issue, but AI can do that. So with the help of historical data, the previous data, everything, with this it can do that. Okay, these are the few examples. IBM Watson, this one of the uh, best application in oncology, and there is a Google Health and a Google Research. Okay, so these are all they're using with all our AI technologies and doing the providing the best solutions to with the available data. Okay, so, and there is a next one, the patient data analytics. Okay, so in this one, based on the patient data, so that one we are, so far we have discussed only related to the diseases. Now it is completely dedicated to one type of patient analysis. Like, so for example, nowadays the diabetes is common to everyone. Okay, so the diabetes, sometimes it is coming our own, like the personal wise, or some like a few things like it will coming from the genes as well. So these all the data, it will analyze it. It can give the recommendations that what type of food we need to do, and food we need to take it, and what type of activities we have to do, everything. It will analyze it and will give the proper output. Okay, the patient, this one. So this entire paragraph is saying that with the help of data, how to judge that, I like, I can say how to conclude one decision, disease will come into, disease will come. Okay, so the one of the Paris Public University Hospital, they have conducted one survey, and they have collected all the data from few people, and they have analyzed all the data, how much of data they are using, the terabyte of data. For example, they have stats, they have collected all the 1100 of terabytes in lifetime they are using, and each day they're doing some 6.4. Okay, and so, like, based on the data they are using, they have concluded that, so most of the people, they are using the data, so I can say the internet of data. Like, so the, if you, they are using their the life, they are analyzed and they are concluded that lifestyle will be sitting a position only, like that. It's okay, so they have, based on this all the data, they are concluded some people having the more metabolism issues, and with the help of this historical data, I can say. Okay, this is what it is described in this article. Okay, and the medical robotics, so this is, so far it is like a applications, this just like a software things there, will do all the human data, historical, every all data, it will collect it and provide the outputs. This is like robotics is the mission, so manual machine things. Okay, so there is a very good surgical robot, there is a Dia Vinci. Okay, this is having very good, it's like it will do all the surgical operations, it can do that, but still it will depend upon the human only, and it will give only the suggestions, and so it will do all the type of actions, and it will show the actions to the doctors, and doctor will do the final operation. So but still very rare cases that robots are doing the treatments. And I think some or 1 or 2 months back, I saw one news. There is a one doctor from Japan, I hope, from Japan. He he done the operation remotely from one place to another place. Actually, he is giving all the instructions to that robot has done the operation successfully. So this is what vital role is the AI's vital role is playing in this medical robotics as well. Okay. And there is a one more advantage, that so there is a space constraints, like so the human hands, we can't put the hands and do this operation. In few cases, in that place also, the medical robots will take care of it and having doing that all the operations very flexibly. Okay. And yeah, so coming to real-time prioritization and triage. Okay. And so now, so we have done the application. So far we have discussed about the patient related things and robotics. Now the prioritization. So what type of prioritization in the sense? So we'll have, for example, so we'll have some little bit symptoms will come for there is a, for example, so there will be some pain, so regularly it is coming, but the people or patients, they will neglect that type of pains, because but this type of AI will check it how frequently it is occurring and what type of pain it is coming, and it will read everything and it will prioritize. So it will give the notification that you have to admit, the hospital need to do very quick action, we have to do that, something type of recommendations, it will do that, this type of AIs. Okay. So these are the two type of examples it will do. It will give the notifications like analytic, the patient, this one will give the prioritization cases. So here you can see the clinical data directs them to suitable medical personnel. So, and okay, so it is also give the proper the person, like which type of doctor we need to reach out. So everything it will give the suggestion. So this type of one AI. And there is a Babylon, provides the applicable health and yeah. So this is also same type of application, and it will read all the type of symptoms, and based on that it will give us recommendation. So which doctor we need to consider and which type of disease we are going to get. So they will, it will guide us, like actually this application AI. Okay. And there is another type of AIs like personalized care or virtual assistants. The virtual assistants, here we can see the personalized cares in the sense, so the patients will need, I can say the patients will have the much more support from the humans, but it will not happen for all the times. The most of the some people having the mostly like nurses or who is taking care of their patients, they need some assistance in the form of mentally help, like they need like mentally, like you can say mental health support, they need it. And there is some like meditation and the meal support, everything. So they want, but the human will not do everything, because sometimes they will have some more priority work, or they may be not happy to serve with the patients, something like will be there. So but the humans like the AIs will give all the without hesitate, it will give all the required inputs, required outputs whenever we required, or how many times we are asking, it will give without hesitate, it will give the required data. Okay. So these are the three type of examples. There is a whom like a human machine interfaces. So it is like It's just like a robot. It will interact with the users directly and give the proper help, I can say. The person with the disabilities, so they it can drive the cars, and it will drive the structure. Okay, so wheelchairs, everything. So it will do some type of human, uh, the robots, I can say. So there we can use this type of help. And there is a rudo, so it will help us for the blind people. So the blind people, so it will give the it will read the required information, and they guide the path, all the things. So it will give the uh, uh, it will help us for the blind people, I can say. There is a chatbots. So nowadays the chatbots is more increasing in each and every sites also, like sites in the sense web pages. Even if you are opening any bank sites, so the bank, for example, in right side corner there will be some chat box will open directly. So it will come like, what do you need and what type of help needed, and everywhere these are type of chatbots, we can say that. Okay, so this is type of software only, and it will read the all the previous issues. So how they will train these chatbots is, so based on the previous user interactions. For example, so I have asked, for example, is mostly they will use it for the customer care things actually. So for example, there is a ICICI bank is there. Bank will have the multiple services will be there. So how, what type of service they will provide, and everything, they will come up with a menus, and based on the menus, which option we are choosing, that option the selected like I can say answers they will give it, but it will not give out of that bond, out of that bound. So they will give some, they will train the few questions only, so it will answer for that questions only. It will not go out of that. It's just like I can say it is a weak AI, weak AI or a narrow AI. Okay, and there is a virtual assistance for nursing. Okay, so virtual assistance in the sense, so mostly maybe I can say it will replace our receptionist in hospital. We'll have the receptionist, will call to them and they will book for the appointment, and uh, we can get the some assistance required, like so the tablets, when we need to take the tablets, and how frequently we have to have it. So all this type of things, the virtual assistants will replace that in nursing sections, what I can say. Okay, so what it will do, so it will book all the appointments also. Based on it will check all the appointments of the doctors, so which slot is available, and it will tag to this doctor and this client. So they, it will book the all the what I can say, the slot bookings, everything. It will do the, it will replace that virtual assistants. Okay, and there is a there is a real time application is a Sensely. So there is a virtual nurse. It will give all the required information, and there is and real time. So and this is one thing, and there is a few more applications. We have a lot of, I think in online we have a lot of applications we have for at least for few diseases like cold, fever, for that. So they will, it will suggest the medicines and we can use that. Okay, and there is a another application, there is a administrative workflow assistance. So this one, it is a collective of all the departments. So from admitting into the hospital, and after for discharging, then climbing of insurance, everything, it will take care of it in a in the form of workflow. Okay, so as of now in real time, so it is not happening in a workflow like so we have to go to the hospital first, we need to call the reception, get the appointment, and then we need to collect the receipt, and we have to take that receipt to that hospital. Later we need to take the like a doctor visit, after that collect the reports. We need to take it them back to us, doctor. They will check all the reports and they will do the analysis, and next the bills collecting. So everything will be in a different paths actually. So this administrative workflow assistance will collect everything in a systematic workflow. So whenever we are booking the appointment, it will come into this first portal, and next so the same will be shared with the doctor. So no need of human interaction. So directly it will collect the appointment, and this appointment will be shared to the doctor. And once we go to the lab, they will take the, like what you can say, the receipt, the blood test results that will collect into the same app, and the same will be shared with the doctor. So the everything will be do the frame with the workflow wise. So there will be separate steps, I can say that. Okay. And yeah, so and this AI also improving in the biomedical research. So biomedical research in the sense, so it will be useful when we are doing the research. Students, they are doing, they have to do some researches. So we'll have lot of resources, I can say, the digital libraries, and there is a I can say the formulas, the chemical related things. So everything in a different sections will have separate things. So but our AI, once we ask them, so it will collect all the multiple information and the related information into one place, and we can so it will save the time and give the best results, I can say. For example, so if you are searching with any I can say the one particular information in Google, okay, so it will give the bunch of results. Okay, but our required information will be somewhere in the 9th row or 10th result, somewhere it will be there. But now if you are using the chatbot, sorry, chat GPT, so if you're asking the any question, it is giving the exact result. It is not asking us to go for another result, go for the next one, choose. It is not giving the multiple options. It is giving the straight answer, so that we can able to save the time, and we are getting the required information. So we can save the time, and mm, yeah, so and we'll get the required information now. So no need of read for another thing. This is what we can say. So this is also one type of one application is there. There is a e-doctor to diagnosis, manage, and pronounces. Okay, so these all are the things when we are going with the medical research. Okay, and there is another type of application is the drug discovery. Okay, so the drug discovery in the sense, so we have the medicines for to identify the, like for example, to discover the drug. Okay, we need to identify the I can say the disease or virus. So virus will have some patterns. For example, last this pandemic, COVID pandemics, right? So this is also one type of virus. So we need to identify the drug. So we need to identify that disease, that virus patterns, how it is behaving. So what type of patterns it is using, what type of structure it is doing. So to recover that, so what type of drug we need to do, so we need to analyze that entire the virus. So it is not uh, it will not happen when we are going with a human reading, like, right? So for that we need to collect all the required images and the patterns, everything but this AI will do collect the information in effectively. So what type of all the drugs, not drugs, so the structure and the how it is resplitting it, everything. So with the help of AI, we can easily get the required information, and we can discover the drug. So by using the deep learning, so they are using by using this deep learning, they are doing the drug discovery. So this is what AI technology we are using in drug discovery, deep learning. Okay. Yeah. So now we will going to discuss. So these are the applications we have discussed. All the applications in real-time scenario. So I will give you small. I will show you the article. Sorry. Yeah. Sorry. So yeah. So far we have discussed about this article only. So here we can see there is a improved disease treatment. So these are the applications we have discussed: precision medicine and the improved disease treatment, diagnostic error reduction and decision support, and medical robotics, and the prioritization and triage, administrative workflow, virtual assistants. This one. Okay, and now so far we have discussed about the applications where we are using this AIs and which places we are doing. So as of now we are discussed about the only advantages, how we are utilizing everything, but there will be some challenges also. So once we know these challenges, we can easily identify the research, so where we can do the research and we can improve the performance, everything. Okay, so our author has given some the challenges, so where we can do that, where we are lacking in that. Okay, this is the what. So the data privacy and cyber security, so this is the most dangerous challenges, I can say that. So because so we are putting each and every entire our details into that AI. So if that AI is utilized in a perfect way, there is everything is good. But if that type of data is miscellaneous, they have used for some different wrong negative way, so it will be huge impact on that patients. So I can say, so this one recently I saw one movie. So in that movie, the one of the lady will have some heart disease. For that, she will implant them some, I don't know the device name. So she will put that device into their heart actually. Okay, so with that help of that device only, the heart will be functioning. Okay, so this the device will send the heartbeat data everything into cloud, and the cloud the application will be utilized. Okay, but one of the person, they will hack the data and they will manipulate the data. So how it is like, so the heart will do the functioning based on some like minute per minute beats per minute, right? So BPM something, so 72 heartbeats like. So what he done is, so it will set for the device actually. Okay, the person has changed that setting to some highly, they have increased that heart rate actually. So due to that, she has died. Okay, so this type of issues will come when we using the artificial intelligence using in a wrong way. That is what is going to explain here. So the data privacy and security, so the data should be always be in a secure way. Okay, and reliability and safety. So and so in the same scenario we can say, so it should be real data, not like so it should, if the something is happen in that particular time, it should happen on that particular time on. It should not done from like after 15 minutes, after 10 minutes or something. It should not like that. So it should be in a on the time, like it should be really uh, relative time, I can say that. So the safety also very important, and the accountability also, accountability of technology use. Okay, so what it is saying that is basically this artificial intelligence or these devices developed by the normal people, like us. So I don't, as a technical persons, okay, as a technical persons don't have the medical knowledge on that. So while developing that application as a non-core person, so they have to take care of everything and give the to know the end-to-end scenarios and how to develop that application. That is what it is doing, the technology of using. Okay, and the potential loss of support system and autonomy. So the actually the I can say maintenance I can say. So the maintenance, like the device, or if you are using the any hardware device, it should be more supportable, like it should not get multiple maintain, it should not comes for the repair, something like that. So it is the tone of that sentence is the it should not come for the multiple damages. Okay, and the challenges in generalization of new populations. Okay, so it is generalization. Okay, it has to use only the particular data, only medical data has to use that, not other things. Okay, and the technology challenges. Okay, so and here also they're saying that it is developing by the humans, so we have to avoid the human errors. And organizational and managerial challenges, so we should not go with the the data misuse. Okay, malicious use is this one. And yeah, so okay, so this type of data, so what we are using is, it is a very highly secure data, so it should not exchange with any the other unauthorized users, and it should not misuse that. Okay, so and malicious use, so it should be motor behaviors that reveal the identity and secret information of involved person. So mostly this is also, it is saying that it should not use for other usage, only for medical purpose. Okay, these are the challenges. So when we are going with the AIs. Okay, and now we'll go with the research areas. One sec, drug discovery. Okay, and the research directions. So AI and machine learning innovations. So mostly we are using the AI for AI. We are using the machine learning techniques. Okay, so there we are using some algorithms is there. So they have developed, but still we need a little bit improvements is required. So for that we have to do the integrate all the electronic health records and do get the better data. Okay, so what we can say is, in machine learning we have to use much more algorithms to do better innovations, better results, I can say. So advanced wearable and implants. So nowadays we are having everyone. So previously we don't have any such wearable devices like a smartwatch. And there is a, for diabetes also we had I heard there is a one strip, it if you hold it the hand, it will identify the our glucose levels, so that the diabetes patients we can and they track their diabetes levels, and they can uh, get their medicines timely manner. So we have to more work on that advanced variables and implants. So we can see in nowadays in movies we can see all this type of advanced technologies. Maybe it should come in future decades, this type of advanced variables. Okay, health tracking systems, biosensors. This is what so previously in application, we have discussed about the precision medicine. So for that, so they have used the AI-driven analysis, genetic data for precise drug targeting. So what he is doing is like previously, which we saw that we have discussed about diabetes also coming based on some previous generations also, and some type of like genes also, right? So these type of innovations or research, we have to do it in the A level. So this is what it is saying, the genetic data and the cyber security in healthcare. So so we said like all our health data is not uh, public data, so it's like a very secure data. So we should not, the data should not expose to public, so it should be very encrypted to end-to-end encrypted. We should maintain it as a end-to-end encrypted. So for that, so there is a hope to innovate the increase the cyber security, like security protocols needs to be implemented in a healthcare system as well. This is what it is saying in a fourth step. And the sustainability in healthcare technology. So and so the durability, I can say, like a durability, more efficient way of for the devices we need it. You should not uh, plug and play devices. So we have to give the energy efficient medical devices, and the correct material, like what we can say, like sustainable materials has to be improved in the healthcare technologies. Though these all are comes in the hardware research technology, like a hardware part. It's not in a software, like the algorithms, not it's not in algorithms, but where we are discussing the cyber security, these all are the software things, like algorithms needs to be implemented in this session. And the precision machine also is like of algorithms where we need to implement more, concentrate on that. And this is the thing, like where we have to focus on the hardware, like devices where we need to implement it. Okay, advanced AI and machine learning. So explainable AI, so where we can see so as of now, in each and every persons will have, if you are asking the question, it is replying that, but it is not able to realize the situation and can't answer this, answer it. So that is what it is not happening. But we have to think about in that explainable AI. So where we can, if you're asking some question, so it should explain the things, like it will collect all the multi-dimensional data and provide the correct answer. So that type of things we can do that. And the integration with the EHRs, electronic health records, I can say. So as of now, we are going with normal records. So maybe in future they will convert, all the reports will be converted into electronic records there. So there we can read everything by the artificial intelligence and perform the analysis and give the medicines. Okay, and the precision medicine and genomics. So this is also same, like as we discussed about the thing. So CRI SPR is one of the genome editing technology. There we can have the scope to add more innovations, research topics. We can do that. So to provide the more info, I can say efficient things. Okay. Okay, and the cyber security and data privacy, it is like a repeated one, I hope. Okay. Okay, so the here also they're discussing about the data privacy and cyber security, having that the keeping of patient records in a very secure manner. So for that, so there we can more focusing on the implementing the secure protocols, where we can do some end-to-end encryptions to add that uh, with the high reliability and the proficiency. Okay, so AI driven threat detection. So if AI can able to has to detect if there is any malware function is happening, something like that. So nowadays even mobiles also detecting that mm, in mobiles will having some pop-up saying that there is a malware app function app is detected, need to delete it, something like that. So it should detect all type of malwares, everything. So there we can focus more things to do the improvements, require the improvements in that. Okay, so sustainable technology development, eco-friendly devices in the sense, so 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 it should not like the devices which we are developing should not be the, it should be the eco-friendly devices, not a uh, not a nature disasters like so I can say it should not disturb the nature. So how the material which we are using for the AI hardware devices should be in a eco-friendly and energy efficient system. So you should not having the so if, for example, even if you're purchasing the mobile, so if it is asking for keep on asking for the charging, so we'll not happy. So same way, so that should be in a energy efficient, it should be life longer, more longer uh, wo- workable like in the healthcare facilities. That's what I can say. So biomechanics and biophysics, next gen development of and prosthetics with advanced neural interfaces. Okay, so this is like uh, in AI as of now. So it is improved till the certain level, but not reached to the neural level interfaces. But there is a much more uh, scope in the developing of the algorithms in the neural level. There is another thing like implantable devices. So last example I have discussed about, there is a implantable devices like so we are keeping some devices inside the body. So that one we have to more take care of it with the best exam like best algorithms. So it should not like, so once you are implant into your body, but if it is not functioning, that is not easy to replace it, right? So we have to more focus on that type of algorithms and the devices. The finally think we have discussed all the things, so I can conclude that. So as of now, so AI is finally AI is giving the very crucial role in our nowadays in as in a digital world. Now we are going with the digital world, right? So the AI having the very vital role in this generations. Okay, and now so even the human also not working with their own mindsets, they completely depending upon the AIs. So where we need to, so we have to build that artificial intelligence in the such a way that it should give the correct results. I can say not a results or outputs in a better thing. So not with the human errors, because so human can do many errors like so the human errors is a uh, they can do that. So it's quite possible, but the mission, so whatever your the human or what our person like the developers who giving that, so they will give it will act according to that one only. So whatever we are training or giving the data, how we are modeling the data, we have to be in a careful that, so that so it will drive very quick the easy way. That is what I can say that. So mm, yeah, that's it. So I can conclude my session. Thank you.
Dear participants, If you have any queries, you can please post in the chat box.
First of all, I would say thanks to everyone for the patience and active listening. Thank you very much. So where I can stop sharing.
Sir, we are truly grateful to you, sir, for gracing this occasion with your
Thank you.
presence and enriching our understanding with your profound knowledge. Thank you so much, sir.
Thank you.